Hello, welcome again to class. Thank you so much for joining. Thank you for watching. Thank you for the previous watch times. Thank you for sharing, for liking, for subscribing, for following. It's another class, another edition of Poultry Science. Now, in the previous class, we started with the last class. We had swollen head syndrome, which is also called rhinotracheitis. Now, I explained in the previous class, I'm trying to go back a bit, that rhinotracheitis or any ailment, you can figure out what it's all about if you're able to know the components of the word, the scientific word, and that's one of the beauty of science. I can figure out what rhino means. It has to do with something about the nose, the trachea, has to do with the upper respiratory tract, and then anything that ends with TIS in science may just be giving you an indication that it's an inflammation. And also, if you know something is inflamed, you have the rubor that is going to have reddish color, is going to have the heat, and there's one other one there, something like that. So inflammation or swelling is also called distension. That's scientific way of putting it. Now, previously on swollen head syndrome, that's the name. We'll look at the cause of agent to be a viral ailment. Now and then, the birds that are susceptible being the chicken, the pheasant, the turkey, and we looked at the signs and symptoms. We've already considered about 8 of them, about 9 of them, and we're going to continue from the 10th. We said that it's an inflammation of the conjunctiva. The conjunctiva is a thin lining of the eyes. The virus infects it, and it also causes inflammation, the swelling of the conjunctiva. There's also the inflammation of the sinuses. The sinuses are air spaces in the head. The skull linking out to the nose, the nasal cavity. The word cavity means opening. You have the nasal cavity, the eyeball, which has the socket, and the buccal cavity, the mouth. Then we've gone through that and see it can affect birds that are affected. Breeder birds, 20% of them may not lay egg, and if they lay egg, the hatchability is dropped up to 30%. And even out of those that get hatched, you see that the chicks, as the result from those birds, are not going to have a good survival rate. Now, I want to encourage you to go back to the previous video and watch. So we'll go straight into this, what we have. Just giving you briefly what it was. Now, in the swollen head syndrome, it's as its name. The head gets swollen, the eyes get repressive or oppressive, get swollen, so that get bulgy, almost covering the eyeballs, you can see. Now, continuing, we'll have a necrotic lesion. Lesion means kind of is peeling off on the mucosa. It is localized, meaning it doesn't spread around the place where it is affected. It stays there, like a lesion, an injury on it, and on the inner surface of the linings of the body. Then you have an oedema. Oedema means a collection of body fluid, particularly liquid one. And oedema means subcutaneous tissue. Subcutaneous means under the skin. Subcutaneous. So there's collection of water or fluid under the skin of the head. So that makes the head swollen. So collection of water under the skin of the head. There's also pus in the skull and on the bronchi. What are the things that made up this pus? Pus are essentially dead cells. Dead cells are gathered in the place as a result of the fight or in quote battle between the innate body defense system and the pathogen. The pathogen means the disease-causing agent. Now, some of the cells will die and then they pile up in that place. Pus, and you know, of course, that pus smells bad, stench is kind of very terrible. Now, rhinotracheitis, which is the swollen head syndrome, is then a treatment. Let's see. The treatment can be as a result or can be met with by the use of antibiotics, help to reduce secondary infection. Now, what secondary infection means is this. there are certain ailments that comes as a result of an existing one. Now, most viral ailments or sicknesses caused by virus don't have treatment. Most times they are managed. If you're lucky, they survive. But when you administer bacteria, is to make sure that antibiotics is to make sure that that primary ailment doesn't lead to a secondary one. So that is what it is. In this case, what that tells us is that it is far better to prevent it than to prevent certain ailments than treating them. Now, what are the preventive measures? For example, you chlorinate drinking water. Chlorine have the ability inside water to form HCl, that is hydrochloric acid or hydrogen chloride, which you look at it, HCl. This HCl is acidic. It has a way of lysing. The word lyse means to tear or cut or lacerate the cells of pathogens. So that is why you use, some of you may have seen use of water guard to treat water, or you use chlorine tablets to treat water, or tanks. So the chlorine reacts with water, chlorine reacts with H2O to give you HCl. Now in this case, the HCl lyses this. You have to be careful with the quantity. Of course, small quantity is enough. Now some say, how can we be taking acid? Yes, let me tell you this, even inside your stomach, it has an acidic medium, HCl, the dilute one. So let's go to the next way of preventing it, use of vaccine. Most viral diseases, most ailments that are caused by virus, is far better to prevent them by use of a vaccine. It could be the live vaccine or the attenuated one. Now look at previous videos. I started this series by talking about vaccines, so go back memory to see some of those things. We talked about the types of vaccines and their effects. Then another way of preventing it is to control dust and other triggers of respiratory problems. Have you seen that certain animals are already susceptible to respiratory problem? Of course, this is a respiratory problem, swollen hair syndrome. It starts as a respiratory problem that ends up making the hair swollen. Other things that can make it worse, you have to reduce them. So the place where you keep the birds, you have to make sure that it's not dusty. So if you're going to be using wood shaving, that's better for deep litter system and not sawdust. If you're going to be giving them feed, thank God these days you have pelletized feed. You can use pelletized feed instead of the mash feed, so reduces possibility or chances of inhaling dust. Now, there may be other information about this that you know. Please put in the comment section. Because of a length to the video, we want to call it a day. We've already treated almost virtually everything about it. If you think there's a part aspect of this that we've not treated, please let us know. But know that we started this in the previous class and we just augmented this. I want you to know that in the next class I'm going to be coming up with another ailment that is that affects chicken. We're going to treat them. So I just want you to stay tuned. Please like, subscribe, and share the video. If you gain value, let your friends also gain from the value. Share them, tell them they can gain from this. Thank you and see you in the next class.